As a physician, making a correct diagnosis for the patients is my responsibility. On average, 1 out of 4 to 5 people suffers from thyroid nodules, a rather high incidence rate. A further examination is thus required. Thyroid neoplasm is the most common thyroid disease. Current detection for thyroid neoplasm includes palpation and ultrasound scanning. With susceptible malignant detection, fine needle aspiration may be necessary for definitive diagnosis. If it is confirmed as a malignant thyroid neoplasm, a thyroidectomy will be recommended. According to survey results, more than 300 million people around the world suffer from thyroid disease. The prevalence for women is 8 times higher than men. Based on the World Health Organization statistics, thyroid cancer ranked as the 8th most frequent cancer among women in the world. In the United States, Canada, and South American region, thyroid cancer ranked as the 5th most common cancer among women. In Asia and China, thyroid cancer ranked as the 9th most prevalent cancer, and the growth rate in China ranked 1st among all cancers. Furthermore, thyroid cancer has become one of the top 10 cancers in Russia, Australia, France, among others. With the alarming increasing incidence of thyroid cancer worldwide, the frequency of indeterminate diagnosis is still very high. Different physicians may arrive at different interpretations over the same image. Sometimes even the same physician may conclude different interpretations over the same image at different times. The inconsistency of the results may reach up to 70%. Moreover, approximately 15% of FNA encountered inadequate sampling. On the other hand, there are still up to 30% indeterminate diagnosis. Even though physicians who made a definitive diagnosis and thus performed thyroidectomy, still up to 50% of results turned out to be benign. Unfortunately, lifelong medication is required for patients who have undergone thyroidectomy. The obstacles can now be overcome. AmCAD Biomed Corporation collaborated with the National Taiwan University and developed a thyroid ultrasound image detection system, AmCAD-UT Detection.
AmCAD-UT Detection is a product that utilizes a lot of patented image processing and pattern recognition technologies. We are able to turn the black and white sonographic images into colorful images. They can help physicians to interpret the images more easily.
With the assistance of AmCAD-UT Detection, all will become different. The AmCAD-UT Detection demonstrates sonographic features on the ultrasound image through visualization. First, AmCAD-UT Detection device enables the exclusive contour outlining and automatic adjustment to allow physicians to rapidly outline the most adequate nodule contours. Next, the device will start to detect, quantify, and visualize all features, including the anechoic area. Anechoic areas are often the indication of cysts, which will be excluded by the software prior to analysis of other features. Echogenicity, a darker gray level within a nodule relative to that of the normal tissue outside the nodule or the muscles, indicates a higher possibility of malignant neoplasm. Echogenic foci, the higher the proportion, the more reddish and orange colors there are, suggesting more calcifications and a higher possibility of malignant thyroid neoplasm. Texture, the higher the homogeneity, the more convergence of the same color scale. Usually a malignant thyroid neoplasm is accompanied by more heterogenic areas. A margin covered by more reddish color indicates a higher chance of indistinct margin. When the nodule has a taller than wide shape, it has higher possibilities of malignancy. The 6 primary visualization features of the AmCAD-UT Detection are: the AmCAD-UT Detection provides a quantitative dashboard with real-time values to demonstrate the possibility of malignant neoplasm as a reference for the physician to make diagnosis and recommendations on the continuous follow-up or FNA. Risk of malignancy. The AmCAD-UT Detection uses the American Thyroid Association guidelines as the primary neoplasm determination criteria, supplementing them with the guidelines of AACE, AME, ETA, RUS. The automatic report generation system not only can greatly save time, but can improve the efficiency of result interpretations and reports. In my opinion, AmCAD-UT is a great medical leap forward for thyroid cancer detection. When physicians use AmCAD-UT, The shapes, sizes, and orientation of thyroid nodules can be automatically defined. The quantification risk index will be instantly provided for a physician's diagnostic reference. The high-frequency application of unnecessary FNA can be avoided. After using AmCAD-UT, physicians can view the cases more objectively to minimize inconsistencies. As a result, the physician can determine the proper treatment with utmost confidence. Patient reports can be generated in half the time as before.
The AmCAD-UT Detection has been approved by US FDA, received CE mark and TFDA approvals. It has become the only computer-aided thyroid ultrasound image detection system available worldwide. There have been several successful applications and experience in Taiwan, China, and other Asia countries. We will continue going global. Ultimately, AmCAD-UT Detection will become the world's indispensable diagnostic tool for thyroid cancer.